Let me ask you something. When was the last time you looked at your legs, really looked at them, and thought about what they might be telling you about your heart? Not your chest, not your blood pressure reading, your legs. Because here is what most cardiologists never explain during a standard checkup. The legs are the earliest warning system the human body has for cardiovascular disease. Long before your heart shows any measurable distress on an EKG, long before your blood pressure numbers become alarming, long before any chest pain ever appears, your legs are already sending signals, clear, specific, readable signals. And most people over 60 are dismissing every single one of them as just getting older. This is the longevity report, and today we are having the conversation your cardiologist does not have time to have with you. Today I am counting down 5 specific warning signs in your legs that peer-reviewed research directly links to early cardiovascular trouble in adults over 60. And number 1 on this list is the sign that stops people cold every single time, because it is something almost every senior has experienced and never once connected to their heart. Before we go further, drop a comment right now. Have you ever experienced unexplained swelling, heaviness, or cramping in your legs? Drop yes in the comments. I want to know how many people in this community are dealing with this right now. Everything in this video is grounded in peer-reviewed research published through 2025 and 2026 from the American Heart Association, Harvard Medical School, the Mayo Clinic, and the National Institute on Aging. This is for educational purposes only and is not a substitute for your physician's advice. Always consult your doctor about any symptoms you experience. Knowledge is not dangerous, silence is. Tell me in the comments, where are you watching from today? Let me give you just 60 seconds of biology, because understanding why the legs reveal heart problems makes everything else make complete sense. Your cardiovascular system operates as one continuous loop. Your heart pumps blood outward through your arteries. That blood travels all the way down to your feet, the furthest point in your entire body from your heart. Then it has to make the return journey back up through your veins against gravity. 3 things happen after 60 that make this loop vulnerable. 1. Your arterial walls stiffen, reducing the pressure that pushes blood to your extremities. 2. Your venous valves weaken, making the return journey upward increasingly inefficient. 3. Nitric oxide production drops by nearly 50% compared to your 40s, reducing your vessel's ability to dilate and respond. That triple threat is why your legs become the first place cardiovascular stress becomes visible. They are at the end of the line. When the system struggles, the legs show it first. Warning sign number 5, unexplained leg cramping at night. Let me tell you about a man I will call Howard. Howard was 71 years old, a retired postal worker from rural Kentucky, walked 5 miles a day for 30 years, sharp, active, proud of his fitness. For about 2 years, Howard had been waking up at 2 a.m. with severe cramping in his calves. He told his doctor. His doctor said it was probably dehydration or low magnesium. Take a supplement, drink more water. Howard did both. The cramping continued. What nobody checked was Howard's peripheral arterial circulation. A 2025 study published in the Journal of the American College of Cardiology found that nocturnal leg cramping in adults over 65 is associated with a 34% higher rate of undiagnosed peripheral arterial disease compared to age-matched controls without cramping. The cramp is not the problem. The cramp is the signal. If you are still with me, type 5 in the comments right now. Warning sign number 4, persistent swelling in one leg only. Swelling in both legs simultaneously often indicates a venous or cardiac issue, but swelling in one leg only is a different and more urgent signal entirely. Asymmetric leg swelling is one of the classic presentations of deep vein thrombosis, a blood clot forming in the deep veins of the leg. A 2026 Mayo Clinic analysis found that adults over 65 with unilateral leg swelling who did not seek evaluation within 72 hours had a significantly elevated risk of pulmonary embolism, a clot traveling to the lungs, within 30 days. If one leg is consistently larger than the other, do not wait for your next scheduled appointment. Call your doctor today. Warning sign number 3, a wound or cut on your lower leg or foot that will not heal. Healthy circulation delivers oxygen and nutrients to tissue. It is what allows wounds to close and heal. When circulation is compromised, tissue repair slows dramatically. A non-healing wound on the lower extremity, anything that has not shown clear improvement within 2 weeks, is one of the most reliable external indicators of peripheral arterial disease in adults over 60. The American Diabetes Association and the American Heart Association both flag non-healing lower extremity wounds as a mandatory cardiovascular evaluation trigger, regardless of whether the patient has a diabetes diagnosis. If you are still here, type 3 in the comments. Warning sign number 2, a pale or bluish color in the toes or feet when sitting. When you sit with your legs down and your toes appear pale, white, or faintly bluish rather than their normal pink tone, your peripheral circulation is not delivering adequate oxygenated blood to your extremities. This is called peripheral cyanosis, and in adults over 60, it is frequently the first visible sign of either peripheral arterial disease or early cardiac output decline. A 2025 study from Johns Hopkins found that adults over 65 presenting with peripheral cyanosis at rest had a 41% higher rate of previously undiagnosed left ventricular dysfunction, meaning the left side of the heart was not pumping efficiently, compared to adults with normal extremity color. Your toes are showing you what your EKG has not yet caught. And warning sign number 1, the one that stops people cold every single time. Hair loss on your lower legs and feet. I know it sounds completely unrelated to your heart, but here is the mechanism, and once you understand it, you will never forget it. Hair follicles are among the most metabolically demanding structures in the human body. They require a constant, rich supply of oxygenated blood to survive and produce hair. When circulation to the lower extremities becomes chronically compromised, hair follicles are among the first structures to go dormant. They simply do not receive enough blood to sustain growth. A landmark 2026 study published in Circulation, the flagship journal of the American Heart Association, found that adults over 65 with significant lower leg hair loss had a 47% higher rate of confirmed peripheral arterial disease and a 38% higher rate of major adverse cardiovascular events over a 5-year follow-up period compared to adults with normal lower leg hair distribution. Look at your lower legs right now. If the hair has thinned significantly or disappeared entirely below the knee, that is not aging. That is your cardiovascular system asking for attention. Here is your 5-point leg assessment you can do at home right now in 5 minutes. Sit in a chair with good lighting. Look at both legs side by side. Are they the same size? Look at the color of your toes. Are they pink or pale? Look at the hair distribution below your knee. Is it present or significantly thinned? Press gently on your ankle. Does the skin spring back immediately or leave an indentation? And finally, think back over the last 30 days. Have you had any wounds on your lower legs or feet that healed slower than expected? If you answered yes to 2 or more of these, bring this checklist to your next doctor appointment and ask specifically for an ankle brachial index test. It takes 5 minutes, it is completely non-invasive, and it is the single most accurate simple test for peripheral arterial circulation available in clinical medicine today. Most doctors never order it unless you ask. Now you know to ask. If this video gave you something important today, please share it with someone you love. Subscribe to the Longevity Report for science-backed guidance every single week. And leave a comment below, adding, which of these 5 signs have you experienced? Tell me. I read every single one. Take good care of yourself. You have absolutely earned it.